Hi, everyone. My name is Sarah Ray from the Bloomfield Public Library. Thank you for joining us tonight. We have Gabby here to let us know, to educate us about how to make the most out of your healthcare visit. Thank you, Gabby.
Great. Thanks, Sarah. I'm going to go ahead and share my screen and get started. Maybe just swap here. Okay. So hi, my name is Gabby Ceccolini. I am the founder of Core Patients, which is an outreach organization to educate patients on making the most of their medical visit. I have worked in medical education for a little over 8 years, and I train individuals to be patients for the purpose of student learning and assessment. So I train people how to be patients in an education session, in an education setting. And I have started to do a little bit of research about how their knowledge of the medical environment and interacting with medical students is impacting their actual real life patient encounters. And so what I found is that their knowledge of the medical visit actually makes them more obviously informed, but empowered patients. They feel more in control of their healthcare. They prepare more, they can give clear explanations of their health. They feel that they are really partners with their healthcare providers and feel that they are, in theory, better healthcare consumers because they're really in control of their own health. And so now I am on a mission to bring the knowledge that the standardized patients have to the community. In theory, just teaching people how to be patients in a medical setting. Now, I am not a healthcare provider, I'm a medical educator, so I will not be giving any sort of medical advice, and all of the medical encounters that I talk about are just for example. Why is all this important? So every year in the US, over 12 million adults who seek outpatient care receive a misdiagnosis. So what that means is 1 in 20 adults who goes into a doctor's office will walk out either being treated for something that they don't have or not being treated for something that they actually have. If you Google the term misdiagnosis, medical error actually shows up. Now, why does this happen? Oftentimes it is a breakdown in communication. This is just a silly little aside here, but as a patient, as not a healthcare provider, we often blame our doctor, or we blame our healthcare provider for that breakdown in communication. I think rarely do people look at the patient role and the role of themselves and think that the breakdown comes from us as the patient. Now, conversations with patients actually contribute to about 60 to 80% of all the knowledge that a doctor uses to figure out what's wrong with us and to figure out how to treat us. So almost all of the information that they are gathering and using to make decisions comes from communication. So I see firsthand that as patients, we play just as much a role in that communication with our provider. And so it's important to understand that as patients, we need to be prepared, truthful, and concise. And I want to talk a little bit about concise because the healthcare landscape has certainly changed as far as timing. The 15-minute medical visit is actually a thing. So where does it come from? This is a study that shows how much time physicians spend with their providers. More than half of all healthcare providers spend less than 16 minutes with us as patients. 16 minutes. Now, there's a reason for this. In 2019, Medicare was trying to come up with a standardized way to have physicians bill their time. And so they came up with this really complicated calculation that I couldn't even really understand myself. But basically what it translated to was 15 minutes. So literally Medicare would reimburse doctors for 15 minutes of time with us. And then private healthcare insurance started to follow. And that's where that 15 minutes came from. On top of that, this is another study that shows the percentage of physicians who spend over 10 hours a week on paperwork and administrative tasks. Now, this is typically stuff, I don't know exactly where it comes from, right? I like to say it comes from sort of above in the process, but this is from 2015 just to 2019. 70% of doctors have to spend over 10 hours a week just doing paperwork and administrative work, on top of actually getting to treat us. And there's lots of other studies that sort of dig deeper into this. And there's one that was really concerning that said that majority of physicians spend in their 15 minutes about 37% of their time actually doing paperwork, right? So they often have their laptops open, or they have their iPads with them, or they're writing down notes, they're doing some kind of work. So in other words, shrink that 15 minutes down to 10 minutes of time where they're actually interacting with the patient. Now, this I can't control, right? I can't control the paperwork and the administrative tasks. I can't control like the work that they have to do, but what I can control is how we as patients can impact the doctor-patient relationship, which ultimately impacts our care. Now, even in that short time, right, that quick 15-minute visit, there is a way to build trust and build relationship with doctors, and we can play a role in that. But because that's how medicine is actually supposed to be, physicians find the time spent interacting with patients to really be the most gratifying part of their work. So I want to educate everybody on kind of where that comes from in terms of how the interaction with the patient is supposed to be a part of the best care. There is, I'm trying to click through here. There is a model of care called patient-centered care. Now, this has been around since probably the 1980s, and it is considered the aspiration of high-quality healthcare systems. The Institute of Medicine defines patient-centered care as care that is respectful of and responsive to individual patient preferences, needs, and values. So literally, patient-centered care puts the patient at the center of care. What that looks like is it's treating us as individuals. So that's the difference to that would be, the old school way, the doctor on the pedestal way, which is a patient comes in and you have diabetes, I treat your diabetes. And this patient comes in, you have diabetes, I treat your diabetes. And this patient comes in with diabetes, you treat the diabetes. Patient-centered care is treating the patient as an individual. It's about building trust. It's about working with your patients to inform them and to perform shared decision-making. So it gives us a voice as the patient, which is kind of a big undertaking, which is where I come into play, because what is that voice? How do you actually interact with your patients? Because this is, and I'll back up a little bit, this is actually a concept that's taught in medical school. So where I work in medical school, students are learning patient-centered care. PA students are learning patient-centered care. It's the model of care that healthcare providers are taught. The outcomes of it is better health, satisfied patients, lower cost overall. Again, it's a big undertaking to think, wait a minute, patient-centered care, I have to play a role in my care, and you do. To get the most individualized care and the best outcomes, you as patients, we do have to play a role in that relationship with the provider. So what does this actually look like in a medical visit? So this is kind of how, when you think of your healthcare visit, your physician or your provider is gathering information from you. Which is talking to you. They'll perform relevant exams. So they figure out what exams to perform. They provide information to us. They're trained to provide information in a way that we can understand. So not using medical jargon, but using information that's easy to follow. They then are supposed to help us make decisions, which also might mean helping us and our families to make decisions, support our emotions, which is all the things that are not necessarily health. So that's like our beliefs, our values, and that encompasses things like religion and finances. So when I have support emotions here, it's really everything else that makes us who we are. So they're expected to do all of this while fostering the relationship. I think the thing that gets me caught up here is the term relationship, again, because it goes both ways. Now, if you can tell, there's kind of a method to this. There's the gathering information, the physical exams, the providing information, there's the supporting and helping us make decisions. Like that's what a healthcare visit looks like. And it is a little bit of, not a little bit, it is there's a model to it. So what I want you all to know, and this is the point of what I want to teach, is that as a patient, there is a beginning, there is a middle, and there is an end to your 15-minute medical visit. And there is a way as patients, and there's a role and responsibilities that we have to play in that to really get the best care. We really can't just show up and say, I don't feel well, or my back hurts, and kind of expect something to happen. There is a specific dialogue, back and forth dialogue, that we have to be a part of. And what that looks like is preparing, engaging, and responding. In the beginning, you're going to prepare, which I'm going to teach you how to prepare so that when you show up, you can participate in the beginning. The engaging is that back and forth information, that dialogue and trust building. And then the responding is, okay, now that the physicians sort of gathered all the information that they have, I'm going to respond and figure out how to come up with those next steps. And all that I'm going to talk about is communication. I'm not going to be teaching anatomy. I'm not teaching biochemistry or anything complicated. It's really just communication. Now, how does communication play that big of a role? Well, let me give you a really easy example. You walk into a bake shop and you say, I would like a chocolate cake. And the baker asks you a couple questions, and this is what you get. You walk into another bake shop and you say, I would like a chocolate cake. I want 3 tiers, a marshmallow filling, and I like Hershey's chocolate and some candles. By the way, I'm allergic to nuts and eggs. What you get looks a lot different just from what you've communicated. Now, this outcome, these cakes here, is what is called a plan of care in a healthcare setting. That outcome is called a plan of care. So in healthcare, your plan of care comes from the dialogue between the physician and between you. So your physician has a number of puzzle pieces. This is their experiences, their mentors, their years of education, their years of training. The healthcare providers are required to do continuing medical education. So they're required to continue doing training even after they finished medical school or PA school or nurse practitioner school. They have mentors, they have colleagues, they have resources. As patients, we have our own puzzle pieces. As individuals, we have our illness, our well-being, our thoughts, our beliefs, our financial state, our lifestyle, nutrition, stressors. We have a ton of puzzle pieces that make up who we are. The goal is at the end of your 15-minute medical visit that what the physician has to work with is this. This is the clearest picture of all of us as of an individual, and all of the resources and the content and knowledge of a physician comes together to have this, so that our plan of care is individualized and will be most individualized for us as patients. The problem is, this is what happens. In that 15-minute doctor's visit, as patients, we show up and we're not really sure what to say. We come in and we say, I don't feel well. This is what's been going on. The doctor spends a lot of time asking us questions. They're doing most of the talking. They're kind of running the show in our visit. Also, as patients, we lie. It's a known thing. It's in research, it's studied. We lie all the time. I mean, I'm in healthcare and I still lie. My doctor says, so tell me, how often are you exercising? And I say, every day I go for like a 30-minute walk. Usually I get in 30 minutes or so. I rarely exercise. Or, they'll say, so tell us, how much are you drinking? And I say, just socially on the weekends. I have a 3-year-old and 1-year-old twins. So I think my doctor can sometimes see through that. So it's a thing, right? I don't lie anymore because now I know the benefit of being truthful, but it is a known study thing that patients lie. The other thing is we just hold back information because we're intimidated by healthcare providers. We don't want to undermine them. We don't think that it's relevant or important. So there's a lot of information that we just don't share with our doctor, or we forget. And in that time where there's the stress of being in a visit with a doctor, or there's the stress of knowing you only have about 15 minutes, we forget things, conversations go different ways, so we don't share information. What ends up happening is at the end of the visit, this is the plan, this is the picture that now your doctor has to work with to come up with a plan of care. They're not mind readers. Doctors are human beings, right? Their healthcare providers are human beings. They have stresses and they have stressors and they have lives. And so we have to take into account that they're really going to treat us based on what is presented to them. And so if this is what's presented to them, the plan of care that you get as a patient is not going to be individualized. You're probably not going to agree to it. And it's not going to treat you as best as you should be treated. So what needs to happen is this, right? We need to go back to this partnership where we need to be prepared, truthful, and concise. Now, I have taken all of the things that patients that I've worked with and trained on preparing for medical visits, and I sent that list to clinicians. And I said, here's what informed patients do. Is this helpful to you? So here's what I sent them, that they come prepared with details of their main concern. They can provide a clear, organized timeline of their symptoms, that they know their past medical history, that they're engaged with sharing information, so they're truthful, they're forthcoming, that they ask questions so that they make sure that they understand the next steps. They feel that it's a real dialogue. Over 90% of the clinicians that I sent this to said that this is either the very or most helpful way that a patient can interact with them. They want us to be interactive. They want us to be active members of our care. So how do you actually do that, right? Now, here's some of the inside scoop a little bit. Let's talk about the beginning of your visit. So in preparing for your visit, there is something that every healthcare provider is taught, and it's called history of present illness, an HPI. This is like a medical term. This is a term used in medical school. Students learn how to take an HPI. It's medical lingo. So what that means is that when you go into a doctor's visit and you have chest pain, there are a series of questions that a doctor is going to ask you to learn all about your chest pain. That's called history of present illness. If you go in with knee pain, there's a series of questions that they're going to ask you, which are pretty much the same as chest pain, to get at what's going on with your knee pain. And it's history of present illness, whatever you're coming in with as your main concern. Keeping in mind here as an aside that when you come into a doctor's visit, the time that is allotted for patients is a main concern. So if you're coming in with 15 concerns, you're coming in with 10 concerns or 3 concerns, which is actually more realistic, your doctor really will likely prioritize in some way what the main concern is. And that's what they're going to want to talk about. There is also some reimbursements there with insurance as far as being reimbursed only for one concern. So keep that in mind as you go to your doctor's visits, that it's talking about a main concern. So how do you present your history of present illness? There is an acronym. A lot of healthcare providers use, there's a few other acronyms that they use, but there's an acronym called OLD carts. I've read and understand that sometimes visuals help people remember. So I'm just going to throw a bunch of pictures of old carts up here so that you, as an easy way to remember the term old carts. So what does it stand for? It's an acronym. So these are the terms it stands for: onset, location, duration, character, associated symptoms, radiation, treatment, severity. This is part of gathering an HPI. So in preparing for visits, I'll break it down for you. So onset, you ask, when did this start? When did my pain start? And what was I doing that caused it? Or what was I doing when I noticed that it first came on? Location, where is the pain located? Right? If I have knee pain, is it the inside of my knee, the outside of my knee, the back of my knee? Duration, how long does it last? So, I got hurt, this is hypothetical. I got hurt 3 days ago. The pain's been lasting for 3 days. Other things to be thinking about is when the pain comes on, how long does it last, right? And that might be, that doesn't really hurt, but it starts to hurt when I run. And when I run, the pain is lasting for the entire time. So that's duration. Character is, how do you describe the pain? Is it dull? Is it throbbing? Is it sharp? Is it a shooting pain? Associated symptoms. Did you notice anything else with it? So is there swelling? Is there bruising? Thinking about my knee pain, or anything else I've seen with it? And oh yeah, there's a rash that I also have on the back of my leg, which is weird. Not for me to do anything with, but just to tell my doctor. Radiation, does the pain move? Is the pain shooting down the back of your leg? Is it shooting around your knee? Do you notice any other pain around that area? Treatment is what makes it better or worse. So what makes the pain better? Well, when I've taken Advil or iced it, it's better. And what makes it worse? When I go down the stairs, it's worse. Severity is on a scale of 1 to 10, how bad is your pain? So 10 being the worst pain you've ever had, and 1 being no pain at all. How bad is the pain? So these items, old carts, HPI, this is when you first go into a doctor's visit and you say, hi, I'm here and I have chest pain. They're going to go through these questions, right? They might not do it in this order and they might not go through all of them, but these are the things that you get at to gather an HPI of a patient. I now do this, and I hope people will do this prior to going to my healthcare visits. I actually put it to the test with my own kids when I brought them to the doctor. I went through, so when did I first notice the fever? And I had to write it down. It does take some work, right? I had to think about it, like, okay, it came on, on Friday, and then on Saturday this happened, and then on Sunday the rash happened. So I wrote that all down so that I was prepared to present it when I walked in, so that when the doctor walked in the visit and said, so, what's going on with your son? I had it all there. I even had my husband, put this to the test. He was going to a dermatologist and he had a rash in his arm. And I said, Jared, what are you going to do? He said, I'm going to go in and say I have a rash in my arm. I was like, no, let's think about when this started, right? And I went through these questions with him. And he came back from the dermatologist and I said, how did it go? He said, well, I showed her the rash. And then I said, well, can I share with you, a little bit about what's been going on? And of course, the doctor said, sure. And so he went through the whole story of when he noticed it and what medications he was using at one point. He kind of went through everything here. And the doctor literally said, had you just showed me your arms, I would have said this. But given that the history that you've just shared with me, I still think it might be this, but I'd like to try this cream instead. And then call me in 2 weeks if it doesn't change it. So by being more upfront and giving his picture and giving the details of all of his concerns, he was treated differently, more individualized. Now having this information and being ready to prepare is what I call my patient presentation. So that the first minute, right, or 2 minutes of your visit should look very different than other people who have not been trained on this or educated on this. If you walk into your doctor's visit and you've been waiting, right, and you're kind of frustrated because of the time, and your doctor comes in and says, hello, and what's going on? You say, oh, I have chest pain. Okay, so now they're going to spend time pulling apart what's going on. Versus if you can come in and say, you've prepared while you've been sitting there, perhaps waiting for them, or you've prepared prior to going in, and they say, okay, what goes up? What's going on? You say, I have chest pain. I noticed it about 3 days ago. I was doing yard work, and you can give my patient presentation. You now have time for your doctor to spend more time during your visit talking about other things. The other thing that's really powerful about this is what some people have shared with me is that when they actually walk in and their doctor says, hey, how's it going? Or what's going on? And they say, well, here's what's going on. And they give their presentation. Many of the patients that I've worked with have said that they literally see a change in their doctor as if their doctor like tunes in a little bit more and says, okay, this person knows a little bit more than the average patient, and this person perhaps cares a little bit more about their health than the average person. And so right there, you as a patient are now contributing to that relationship building. And the onus is not all on the physician to do that. You've now played a part in that, and that dialogue can continue. So again, by doing this in the beginning, it gives you more time to talk about other things, which would be the middle part of your visit. What I'm going to show you is a lot of information, nothing for you to be memorizing, but I just want to put it all out there. So the middle part of your visit is to talk about other things in your health, and then also your feelings and beliefs and concerns. So the other things in your health, this is the engage piece, are items such as your past medical history, family history, social history. In the format of a medical interview, again, what medical students are learning, there's that HPI portion, but then there's an opportunity for them to now pick and choose from your past medical history, family history, social history, and lifestyle, other questions that they have, which are to them the puzzle pieces, because they're working towards trying to figure out what's wrong with us. Now, if I come in with a cough, right, likely they're going to ask about tobacco use, right? And these, I'm not a healthcare provider, so they may ask about other things. But if I come in with a cough, they're probably going to ask about that. And if I lie, they're going to treat me differently. But typically they'll ask questions about past medical history, like medications, specialists that you've seen, any sort of hospitalizations or surgeries you've had, family history. They're looking to see if there's trends in family history. So if I come in with chest pain, they're going to say, anybody in your family ever had, heart failure? The healthcare providers are trained to ask these questions, and my role and your role as a patient in that middle is to be engaged so that you can give those truthful and honest answers for when they're asking you these questions. Now, some people might think, well, what's the point of them? Right? There's my charts and there's medical records that house a lot of this information. which is very great. And I think they're very useful, but even me as a 33-year-old, fairly very healthy individual, typically when I go to my doctor's visits, there's still something wrong, right? They have a medication that I'm on that I'm actually not on, or they have something written on there that they still haven't removed in 3 years. So oftentimes those healthcare records are wrong. The other thing is they often just kind of verify what's on my record and say, has anything changed? Now, as a patient, I wouldn't know what's relevant. I'm telling you here, like these are all, basically everything in your lifestyle is relevant to your health. Any new things that have happened in your medical history, like visiting a holistic healthcare provider or a chiropractor or even a healthcare provider out of your system, like that information isn't going to show up in your visit or in your chart. So that's information is also part of the preparing that you should be thinking about, just in the event that they might ask you about it. Part of this knowledge and part of the preparing that you now will do as a patient, you might do your own research and have beliefs on what you think is going on, right? You might think, oh, I've talked to a friend who's a nurse. I've talked to my neighbor who's a PA or whatever the case might be, or you've done some internet searches, and you as the patient, knowing your health and your lifestyle, have a sense of what you might think is actually going on. So that is a term that is taught, again, to providers on how to interact with us. It's something called patient perspective. So this is a concept or a communication tool that healthcare providers are trained on how to interact with us. And what they do is they simply say, so what do you think is going on? And that gives you the opportunity as the patient to say, well, I think it's this, or, since you've asked, I think it's really just a sprain, or, I happen to be doing some internet searches and this is what I found. And, here's what I think might be going on. When I surveyed the clinicians about what information they found useful about patients, there was an open dialogue box. And I actually had doctors say to me, getting patients sharing their perspective is helpful to me to come up with a differential, which is like figuring out what it is you have, but also a plan of care. So they literally said getting this perspective is helpful for them on how to treat you. We also all, I think, for the most part, are, Googling our symptoms, or we have some kind of a sense or beliefs of what we might think is be going on, or we might just have feelings about it. Like if I show up with recurring headaches, I might not come out and say, hey, I'm really nervous that I might have a brain tumor, right? I'm thinking that's the doctor's they'll laugh at me or something. But these are legitimate concerns that in patient-centered care should be shared, so that either doctors can say, you know what, I have similar concerns and here's what we're going to do. Or they're going to say, don't worry, it's definitely not that. And here's why, and you don't have to worry. And now just by us talking that through, again, building that relationship and that trust. If your provider doesn't ask, but you want to bring it up, I think an easy thing to do, and like an easy way to start the conversation is to say, can I share with you what I think may be going on? I can guarantee you almost every provider is going to say, absolutely, right? They do enjoy that dialogue. And so once you say, can I share with you what I think may be going on? And they say, sure. You say, well, here's what I've been looking up, or here's what I've been thinking, or here's what I think is going on. And now you can have that other dialogue. So that's, again, something called patient perspective. So where are we at right now? Prepare for your patient presentation. That's kind of like your medical picture. You're engaging, which is that sharing that information, that dialogue that's back and forth, and then patient perspective, which is what you think is going on. So now we round out with the respond, which is the end part of the visit. So the end part of your visit, right, and I'll back up just a little bit. You have the beginning, which is your presentation, the middle, which is that back and forth dialogue, and that's sharing your thoughts and beliefs. And then the end is the shared decision-making. Some crazy statistics here, but patients only remember about 49% of decisions and recommendations made to us when we talk with their doctors. And then on top of that, about 20% of patients are actually compliant with their treatment, meaning 20% of people who go to the doctor visit actually do what it is that their doctor tells them to do. it may seem like a crazy concept, but there's a lot of reasons for this. One is health literacy. People just don't understand the next steps. One is people don't realize that they can come up with a different plan. So they're sitting there thinking like, this isn't going to work for me, but I'm just going to nod my head and get out of here and say, okay. A lot of times people just sort of are hearing it and nodding their heads and saying, yeah, that sounds good. And then they walk out, but their understanding of the treatment is not actually what was recommended to them. So perhaps they're following a treatment, but not the one that was actually recommended. And I mean, I can even see how I could be guilty of this. I went to a doctor after I had my twins. I had some GI issues, and I went to a gastroenterologist, and she had said, listen, I really think that we should I want to do a workup just to see where you're at. So that would be like a CAT scan and an endoscopy and something else. And I was sitting there, and in my head, I'm thinking, okay, she wants me to do all these things, and I could just say yes, okay, but I really just want to go home. And so I easily could have seen myself being like, okay, yep, that's fine. Well, yeah, I'll do some follow-up appointments, and then just leaving, but not actually doing it. Instead, what I said to her, I said, I really don't want to do this. I don't have the time to do this. I'm feeling great. I don't think it's needed. Do I have to be doing them? And she said, no, absolutely not. You don't have to. You can just leave and live your life. And if you have any more issues, just call me. So it's interesting. I never actually asked her, but I also wonder if, as a gastroenterologist, I was wondering if she thought that maybe as the patient, I had some expectation that there was a plan in place. And so she just felt the need to share it. And then when I spoke up and said, I don't really want to do that. So what is shared decision making? Again, this is a term that's taught in medical school. It's a term that physicians understand. What it is that your provider will say, here's what I think is going on. Here is what we should do. And what do you think about that? So this is the end of your visit. When you hear it as the patient, if you agree with it, if it's something you can follow through with, you say, okay, so I'm going to, and then repeat what it is your doctor said to you, because oftentimes we hear things differently than how they're shared with us. There's a medical communication method called the teach back method, which doctors will tell us something, and then literally they're supposed to say, can you repeat that to me? It's called teach back. So I'm telling you to do this without them even asking. Say, okay, I agree with that, and here's what I'm going to do. Now, if they tell you a plan of care, and there's a plan of care that they're coming up with, and we have to remember, gone are the days where you go into your doctor visit, say, this is what's wrong with me, and say, boom, here, take this pill and you're cured, or here's what you have, and here's a shot and you're done. Physicians are trained to come up with a plan of care, which is often involves something that as patients, we have to be responsible for after the fact, whether it's getting to another visit or whether it is getting our medication and following through on it. So they are just giving us the plan. But as patients, you have to understand that we need to take responsibility to then follow through on that plan and actually maintain the rest of our health. This is just that 15-minute visit of our whole health. So the other thing is, if you don't agree with it, or for something that you can't do, you can certainly say, is there another option? Or I don't think this is going to work for me. One of the patients that I worked with was told that he had to do physical therapy, and he had to go in 3 times a week to a physical therapist's office. And he said to his doctor, I really don't want to go into an office. I don't want to have to keep going to a physical therapist's office. Is there another option? And the doctor said, yes. Here is at-home exercises that you can do. And here is the physical therapist to call into at the end of the week, just to kind of touch base with and see if you have any questions. And that's it. And you can do it yourself. And he said, great, I trust that I will manage this myself. I know I will. And that was what worked for him. The other thing to notice at this point in the visit is your emotions. So if you're feeling scared or confused or embarrassed, or if you're just really if you take a moment to think and feel like you're not satisfied with the outcome, or you don't know what the next steps are, here is the opportunity to really have that dialogue and say things like, I'm confused. I don't understand this. I'm scared about, I'm worried about, and talk about that with your provider so that they can either alleviate your fears or your confusion, or they can help you get to the next steps. This, if I think there's many things that bother me, right, as patients when they leave, if they feel like they didn't get out of their visit because they leave feeling they didn't get their questions answered, or they didn't have a chance to talk about certain things. And so, or they get frustrated because they're being sent from doctor to doctor to doctor, and there's a lot of frustration. So that in your visit with your doctor, again, they're human beings. And so as the patient, we have that opportunity to have that dialogue with them and say things like, here are my concerns, here's what's happening next. What do you think? And this gives you some control of figuring out a plan of care that really works for you. So all of this now wrapped up together, right? You're preparing with old carts to have your patient presentation, which is that first 1 to 2 minutes of your visit. The other thing is sometimes you might not be given an opportunity to give your presentation. And so, and this happened to me with actually my son when I took him to the doctor. The doctor walked in and said, oh, I see the rash. When did the fever start? So she didn't even really give me a chance to give a story, but she asked, when did the fever start? I said, here's when it started. And then she said, was there anything else you noticed? I said, yes, this and this and this. It was so efficient. I felt in control. I felt like I was a partner, but it took the work of writing all that down. Then that in-between information was that sharing information of, she asked some other questions. She asked some specific questions that, again, trained as a healthcare provider, she knew to ask, right? And I leave that up to the provider. You ask me the questions you need to ask to help you with those puzzle pieces to figure out the best plan of care, and I'm ready to answer them. Also in that middle part of the interview is where I said things like, here's other information I didn't share that I think that I'd like to share with you. And I just put it on the table. By the way, he had a cough for 2 days, and you just put it out on the table. And there's that back and forth that they either say, oh, thank you, that's good to know, or it will lead them in another direction to ask questions. You have the time to have that dialogue because you've done that patient presentation in the beginning. And then the end part of your visit, which is the shared decision making, which is understanding the plan of care for your next steps, so that you now can leave your doctor's visit feeling like, okay, I know exactly what to do next, and I agree with it. The outcomes of all this and these are the outcomes of the patients that I initially did my study with in the beginning, as far as learning about what it is that they know as a healthcare visit impacts their care. They feel they're better healthcare consumers. They're in more control of their health. They're partners with their physicians. They have more efficient doctor's visits. So they're not seeing doctor after doctor after doctor. I think my husband's putting the kids to bed. If you hear them crying in the background, I'm sorry. So they have more efficient doctor's visits where they're going in that 15 minutes, they're having that dialogue, and they're not being passed on from doctor to doctor. And then the quicker recovery and better outcomes come from the fact that now that you have the knowledge of understanding that after you leave the visit, there is a plan of care that you are responsible for. So if you understand that you have to be in agreement of that plan and know that you'll follow through on it, you're more likely to follow through on it. So those are the outcomes that I'm hopeful for. With all of this, again, Core Patients is a site that I started. It's an organization I started, and it stands for Community Relationships Empowering Patients, because I'm trying to make these relationships with the community as a community member, not as a healthcare provider, to give you the skills and understand the roles and responsibilities of a patient. So if you actually go to the site under services, there is resources that give you some clear helpful tips. It has old carts written out. It has just helpful dialogue that we talked about in the presentation on how to start those conversations with your doctor, some wording to use. And then also the last piece about all of this, it's really easy to just talk about, but it is, I understand that doctor's visits are intimidating, and there does take some practice. So writing out things like old cards, or writing out your questions beforehand, and actually practicing asking them, perhaps sounds somewhat silly, but is a great way to prepare for, again, those quick 15 minutes that you have with your provider. So so that's it. That I try to keep this brief and to the point, and we could go in many directions based on questions that you might have, or individual questions. But That's it. And then there is also, so for anybody who will be watching this recorded, perhaps on the website under services, if you go to educational lecture, there's actually a link right there to a survey. So you can click the survey, it's live, and give some feedback on the presentation.